Welcome to the Stepping On Training Orientation video to best prepare you for your application to becoming a facilitator and to understand the program and its time commitment. And as a part of your application, we ask that you take time to watch this video and then follow the link on the WEHA website to then fill out your application. This program is to prepare individuals for the upcoming training to become a facilitator of this program. We'll start with an overview of the program itself, why it's needed, the proven outcomes, and the workshop's basics. Then we'll talk about the reach that this program has in Wisconsin, nationwide, and the team that you'll be joining. And finally, we'll go over what it means to be a workshop facilitator, what you can expect from us here at WEHA, and what we expect from you before, during, and after the training to become a workshop facilitator. Next, I'll put on my program expert hat and tell you all about the specifics for the Stepping On program. Why is Stepping On needed? Well, we know that falls are not a normal part of aging and that they are preventable. 1 in 4 adults aged 65 years and older fall every year, and fall-related injuries are also the leading cause of death not only in Wisconsin, but nationally for older persons. And the majority of the falls do occur at home. When we think about a fall, we have to think about the consequences that come with a fall. We know that every 11 seconds, an older adult is treated in the emergency room for a fall, and every 19 minutes, an older adult does die from a fall. Falls do contribute to about 40% of the nursing home admissions, and falls cost $50 billion annually across the nation. And 70% of those costs are covered by Medicare and Medicaid. So when we think about a fall, we have to think about not only the cost that is associated with it, but we also have to think about the emotional toll that it takes on the person that fell, as well as the fear of falling, where they reduce their activity and isolation, which in the end causes and elevates their risk for another fall. To share a little bit about the Stepping On program, I want to share a little bit about the history and the development. The program was actually developed in Australia by Dr. Lindy Clemson and Dr. Megan Swan. This was tested and implemented in a community setting in Australia as well as here in Wisconsin. From there, the program is developed and organized as a 2-hour session once a week for 7 weeks. Along with those 7 weeks, we do a home visit or a phone call, and then finally a follow-up booster session that is about 2 to 3 months after the last session. Each program will have about 10 to 14 participants and is led by 2 trained facilitators or an experienced trained facilitator and a peer leader. Some of the core principles that are associated with Stepping On includes facilitation to affect behavior change, also decision-making as a process, principles of adult education, self-efficacy as a tool for change, mastery experience as a tool for change, group process, and the preventive framework. The Stepping On program has gone through research and is now shown to be evidence-based. It also meets the Administration on Aging's highest standard, and when developed by Dr. Lindy Clemson and Megan Swan, Dr. Jane Mahoney at UW-Madison was then able to bring it to the United States. And over the years, she was able to develop the program to what we now know it today through pilot testing, refinement, and evaluative research, all to show that it is proven to work effectively when implemented the same way. You'll notice that the Stepping On program is a CDC-approved fall prevention program because of it being multifactorial, which means that it focuses on balance and strengthening exercises, linking them to daily function, as well as advancing the exercises. We also take a look at vision, medication review, and home modification. A few of the other components that play into the multifactorial part is that we do include guest experts as well that include a physical therapist, a vision expert, a medication expert, and a community safety expert. Because Stepping On is built to help individuals maintain at home and stay safe, there's a target population that the program has been proven to benefit. You want to look for individuals that are aged 60 years and older, that they're at risk for falling, that they have fallen in the past year or have a fear of falling, that they're community dwelling, which means that they live in their own home or apartment, that they're cognitively intact, so then that way they can make changes and apply the tools and the knowledge that they get in the class. They walk independently or with a cane. They can use a walker outside of their home. And then they also must be able to speak and understand conversational English or the language in which the program is being provided in. The Stepping On program has topics that include building trust and risk appraisal, balance and strengthening exercise and the home practice that's associated with that, home hazards and safety modifications, community safety, bone health, medication management, sleep medication alternatives, safe footwear and safe clothing, and vision and falls. The guest experts that I'd mentioned in the previous slide do cover some of these topics. If we take a little closer look at the Stepping On program week by week, you'll see in session 1 we cover introductions, overview, and then also getting input from the participants as to what additional topics they would like to see being covered. In session 2, we go through the exercises and moving about safely. In session 3, we advance the exercises and discuss home hazards. In session 4, we have vision and falls, community safety, and footwear. Session 5, we have medication management, bone health, and sleeping better. And session 6 is getting out and about safely, where this is a physical therapist comes and does one-on-one approach with the participants to then navigate out into the community, whether it's going up and down a curb, utilizing stairs, or going on uneven ground. And then finally in session 7, we review and plan ahead. We discuss long-term goals that we focus on that we will then later cover in the booster session. If we take a little closer look at the Stepping On program week by week, you'll see in session 1 we cover introductions, overview, and then also getting input from the participants as to what additional topics they would like to see being covered. In session 2, we go through the exercises and moving about safely. In session 3, we advance the exercises and discuss home hazards. In session 4, we have vision and falls, community safety, and footwear. Session 5, we have medication management, bone health, and sleeping better. And session 6 is getting out and about safely, where this is a physical therapist comes and does one-on-one approach with the participants to then navigate out into the community, whether it's going up and down a curb, utilizing stairs, or going on uneven ground. And then finally in session 7, we review and plan ahead. We discuss long-term goals that we focus on that we will then later cover in the booster session. During the training to become a workshop leader, you will receive a leader's manual that has all of the instructions and script when leading your first workshop in your community. You will receive a leader manual, a leader toolkit, access to online resources, and your first pair of ankle weights that are required to lead a workshop. The display will be covered in the training, but it is a display of items that relate to preventing falls. There are 4 guest experts, a physical therapist, a vision expert, community safety expert, and a medication expert, along with a past participant. Ankle weights, handouts, and exercise manuals are required for all participants to use during the course of the 7-week workshop series. Your local area is in charge of supplying these items. You will learn ways to cover these items through your agency and partners. All of these topics will be addressed in more detail at the training to better prepare you. Other materials needed are blank flip chart pads, tape, and markers, access to a projector and DVD player, and offering healthy snacks to participants is also a requirement of the Stepping On program. The dissemination work began in 2006 in the state of Wisconsin when Dr. Jane Mahoney, and in partnership with Kenosha County, had brought the program over to the United States. The program has been disseminated in a range of agencies that provided the workshop, as well as a variety of host sites. We also had a range of professionals and peers who served as the leaders. In 2010 is when the Stepping On program went outside of the Wisconsin walls and began to grow nationwide. Today in 2018, currently at 22 states and 36 individual license holders. For the facilitator training, we ask that you come in pairs or solo if you're already in an area that has a trained facilitator to co-facilitate with you. The 3 full days start at 8 a.m. and end around 4:30 to 5 p.m. each day. There will be lots of discussions to help you learn in areas such as fall prevention, along with the power of evidence-based programming and the impact it has on those who attend. We'll also discuss the curriculum of the Stepping On program. Essentially, you will see the master trainers model most of the activities in the training for you, as if you were a participant in the workshop. You'll also learn new skills like group facilitation techniques, and this includes practice facilitation in front of your peers and working through possible scenarios. You'll also learn the various ways you are supported throughout the process, such as in your local area, statewide, and nationwide. We're always here to help. So missing even a piece of this training could greatly affect your full understanding of the program and its offering. We're looking for individuals who enjoy helping people, can speak comfortably in front of a small group, and can commit to the 3 full days of training. Once a certified facilitator, you'll need to block about 4 hours a week when leading the 7-week series. This includes traveling to and from your workshop, the setup time, conducting the 2-hour workshop, and packing things up. Some additional time during the week may be needed to set aside to prepare for upcoming sessions and to follow up with participants. There's no messing with perfection, meaning the information and the way it is to be delivered in the workshop is already set for you. In the training, we'll teach you facilitation techniques and model skills to prepare you to lead the workshop with another certified facilitator or a peer leader. You will help others learn how to take small steps towards permanent, positive changes and a healthier living. You will be building people's confidence in the ability to prevent falls. Let's talk about the expectations in becoming a facilitator. We ask again that you attend the entire 3 full-day training for becoming a facilitator. We also want you to work with local program providers and partners within your community. And we also expect that the programs are led in pairs. The pairs can either be both trained facilitators or one trained facilitator and one peer leader. We also ask that you at least lead 2 workshops each year. We want you to follow the facilitator manual, also secure and distribute weights to workshop participants, prepare and use the Stepping On display, copy and distribute the exercise manual and handouts at appropriate times, invite, prepare, and host 4 guest experts, and then finally to follow the WEHA administration protocols. One way to help prep you for success is gathering your implementation team. These are different details that you want to think through in preparation, such as selecting your dates and times for your first workshop. Decide whether the workshop will be free or will there be a fee. Select and reserve a site, room, and make sure that the room arrangement is configured ahead of time. Also talk through who will submit the workshop notification form to WEHA if you're in Wisconsin. What agency will receive workshop registrations, and making sure that they understand the registration protocol for Stepping On. Also, learning the outreach and marketing. We have tons of tools on the WEHA website for templates for you to utilize. And also thinking about the presentations in terms of where you may go and who will present the information. And then finally, understanding the data collection protocol. That can both be found on the WEHA's website and will also be covered in the training. And then finally, talking about your financial needs. Will there be funding that's needed to help support the efforts of bringing stepping on to your community? In order to provide organizational support to our program facilitators, we have a process to engage local leadership through the program provider registration. Program providers are organizations that deliver one or more of the WEHA evidence-based healthy aging programs in their local community or communities. These organizations employ or support volunteer program facilitators. This may look different in every area, as there may be multiple organizations working together to deliver the program, therefore multiple program providers. So who is your program provider? If your employer is paying your time in facilitating the workshops, they are your program provider organization. If you are a volunteer, your program provider is the organization for which you are facilitating the workshops for. If you are on your own completely, please contact WEHA. We'll either assist you in determining a local organization that could be your program provider, or if that still doesn't apply, WEHA can be your program provider organization. So how to register your program provider organization? There's a simple one-page form that can be filled out online. This all includes organization contact name and information, WEHA programs administered, geographic area served, and all registered program providers receive dedicated organizational support from WEHA. As previously overviewed, you and the registered program provider and possibly other partners will fill out the planning guide together. I know you've just received a lot of information. Let me reassure you, it's all in an effort to see the bigger picture of these amazing programs. Further, we want you and your community to feel ready for the training and ready to begin the workshops. These last few slides will overview the support that there is for you as a facilitator, because the facilitator training is only a part of the support we give you. After the facilitator training, there will be a post-training meeting held over the phone. These happen roughly about 6 to 8 weeks after your training. It's a check-in rather than a checkup. We'll review a few WEHA-related items, but mostly it's to hear from you and your fellow trainees about how things are going since the last day of training. We also have a facilitator section on the WEHA website. There you can find all the resources, current handouts, and whatever else is needed to plan, organize, and prepare for your workshops. We have a facilitator listserv. After the training, your preferred email address will be added to the facilitator listserv or discussion board. This is a group made up of other active facilitators around the state in the program. It's a way to share, discuss, and get event or important program updates from WEHA. Ongoing technical assistance is really important for the success of a program. No facilitator should be flying solo. Building a local network of partnered program providers will not only be a great support to you, but also to ensure program success and improve the health of the community. The more people hear and learn about this low-cost, effective community wellness workshop, the better. If you don't know who your local program provider point person is, please contact Jill Rankin. WEHA staff are available to help you with any questions. If you're confused about the curriculum or need advice about a situation, we're always here to help. There's no wrong door. If Jill doesn't have an answer, she'll help find someone who does. The office is a wealth of knowledge and has some very wonderful resources at our fingertips, such as experienced facilitators and coordinators. Periodically, we'll offer webinars about this program. The topics may be about best practices, highlighting a local area, bright idea, or showcasing a new concept to try. Announcement about these offerings will be made on the facilitator listserv. We want you to know how much we value your commitment and that we're here to help. I hope you're feeling prepared and excited. Are you ready to become a facilitator of these workshops? Your first step is to complete the facilitator application found on our website to save your place at the facilitator training. Remember, space is limited. Commit to the requirements outlined in the application. You will be sent a copy of these requirements with your application confirmation. There is a cost also to the training, and you can pay by credit card during the application process or select the invoice option. Invoices are sent after the training concludes. And remember to fill out the planning guide with your registered program provider in preparation for conducting your first workshop. Lastly, keep eyes on your email. We'll send a confirmation that we received your application. Then, once reviewed by staff, you'll receive an approval email confirming your place in the training and outlining all the detailed logistics, like time, location, any pre-homework or expectations. Lastly, you'll receive a reminder email closer to your scheduled training. Thank you for your attention today. If you have any questions or concerns, please contact us. We gave a lot of information, and it's better to ask than to unpleasantly be surprised. A secondary big thanks is for being interested in this impactful work. These programs are valuable medicine for your community. Your success betters their health and their well-being. We couldn't do it without you, so get your application in and we'll be seeing you at training.